In today's video, we're going to go over something that I've gone viral for multiple times now on multiple different platforms. And every single time that we go over this with different people in the clinic or online, people are always really surprised that this actually works. We're going to talk about how to deal with constipation with just movement. Hi, my name is Oriana. I'm a pelvic health physical therapist assistant, and I love teaching people how to do bowel motility, how to increase that bowel motility with movement strategies, breathing strategies, and different types of massage strategies. So we're going to go ahead and get into it. I'm going to try to put a little image right here, but as you can see, that abdominal cavity, the majority of your abdomen is just intestines. You have some important organs that are underneath the intestines. So if you're a female, you're going to have your uterus, your ovaries, etc. If you're a male, you just kind of have like your bladder and the bottom of your rectum. But besides that, you just have mostly your intestines, your small intestines, your large intestines. And then what sits on top of that is going to be the diaphragm. And underneath the diaphragm are a ton of little organs that we know about too, like, the liver, things like that. One of the reasons why breathing is so incredibly important whenever you are trying to deal with constipation is because every single time that you take a deep breath in, that diaphragm goes down and massages that tissue, and every single time that you exhale, it releases. So with just breathing alone, with just breathing and making your exhales nice and long, even making your inhales nice and long, just by doing that, you are telling your nervous system like, hey, I'm chill, nobody's attacking us, we're good to go. And then you are also literally massaging stuff through. With any muscle in our body, whenever we massage it and whenever we utilize it, then we're actually able to bring increased blood flow, and that increased blood flow helps everything in that tissue work better. That is just what happens throughout the whole entire body. The intestines, the bowels, and the small intestines, those are just a type of muscle. So if we massage that muscle, if we massage it with that breath or that physical massage or apply pressure to it, then we're literally telling that tissue to get some blood flow to it to move a little bit better. So I'm going to show you my favorite moves to do with patients, my favorite moves to do on myself, and I'll kind of guide you through each one. Unfortunately, my microphone is broken, so I hope that you can hear me. I apologize if the audio is kind of like off. I apologize for that. But first things first is you lay down on your back and bring your knees in towards your chest. Even if you have a lot of tissue here, that act of bending your hips like this is really good. So if you are somebody who has a lot of tissue in this space, you wouldn't have your knees closed like this. You would instead have your knees open, almost like a happy baby if you were doing yoga. So you could do that, or you could do that, but we want to get this deep hip flexion because it's going to literally stretch out the muscle that goes around your anus. And if we can relax that muscle, then we can allow things to come through a little bit more. So you would just go right here and take a few deep breaths in and out. Then you would wrap your fingers around one knee and put your other leg out like this. Some people have really tight hip flexors, so if your hip is a little bit extended like this, because that's just what's most comfortable, that's okay. But letting that leg just drop as what is comfortable, pulling that other knee towards that same shoulder. So it looks like this from the side. It's like I'm pulling my right knee towards my right shoulder. I'm kind of like massaging just like the outer part of my abdomen here. And then you would just be here as you take deep breaths. Sometimes if you're constipated, doing these moves can feel not the most comfortable, but you're not harming any tissue that is down here. If it's really that uncomfortable, it means you probably really need the stretch. Then you would switch your legs, so we'll do it around the other leg. Same thing. Missing that rib cage, so I'm getting like the lower part of my abdomen. And I like to breathe into that space. So in my mind, I feel like as my air is going in through my nose, I notice that it's traveling in through my nose, to the back of my throat, down my lungs, all the way down into the space where I feel that compression. Next up, I like to bend both knees so that way my feet are on the floor. We call this hook line. And I just allow my legs to fall to one side. When I used to teach yoga, I'd always say one side was more important than the other. But honestly, just massaging the bowels is like primo. And my arms are just like out like a T, like that. And then you would go to the other side. Again, if you can allow your inhales and exhales to be nice and long, that'd probably be really helpful for your digestive system. And then we'll roll over onto our belly. Now, if you're somebody who deals with a lot of back pain, then it's really good to have a pillow underneath your abdomen, so underneath like this space right here. That way it just relieves the tension through your low back. If you're not, like if your back feels totally fine on your belly, that's great. I like to stack my palms on top of each other and then put my forehead down on my palms like that. And then I just take deep breaths, and I want you to notice how as I inhale, my back is gonna expand like crazy. So take a deep breath in and out. And then I like to bend my knees like so and rock legs side to side like so. And just do that for a little while I continue to breathe. One of my other favorites is that, especially when I was pregnant, it feels really good to have your hips up high a little bit because it allows gravity to pull the intestines down, and then whenever you come back upright, it feels really, really good. It just kind of like continues massage, get some lymph drainage going, get some blood work going. Make sure that with whatever you're doing, you're not contracting your core. You want to let your belly just hang out. Like, don't worry about what you look like, nothing like that. Just let the belly hang out. And that is it for the belly massage, or for the bowel motility movement. Let's go over the belly massage next. All right, now for the belly massage, if we look over at our image, we see that the bowels go up on the right side, over, and then down on that left side, right? Up on the right side, over, down on that left side. And so we're gonna mimic that with some massage. So you'll see my abdomen right here. And then this is my right side. I'm gonna go up, over, and down. And when I apply pressure, I'm applying like pretty firm pressure, like it's like that, but I'm not digging it in like crazy, right? I'm just, I'm using like my whole entire fingertip, and I'm applying that deep pressure. So that's how I'm doing it. I like to do the circles, especially after I had my son. My belly's a little bit more stretchy than it used to be, so the circles feel a lot better to me. But you can always just do sweeps as well. I'm going over and then down. And then one of my other favorite techniques is that you can actually hold your belly. So you could do like a little scoop. And if these are my hip bones, I like to go on the inside and scoop that up and just breathe into that space too. So that is it. It is really that simple. It is really extremely helpful. I bet if you were to do this every morning, every night, you were to practice on like that down regulation, obviously get some fiber, some water, some magnesium, some potassium in your diet. All of those things will help, but you don't need to go rush straight to get a laxative. Try the massage before you try the over-the-counter medication. I swear it really, really does help. Follow for more if you're interested. Don't forget to like, comment, share, and I will see you in the next video. Bye.